Today, we are thrilled to welcome three experts who will each speak to a different but very connected part of the care journey. This will be a great opportunity to engage with experts, to examine not just the issues, but ways to assist in creating better communication, better outcomes, and to recognize the value and the dignity of seniors in our communities. So I just want to see do we have anyone responding in the chat in terms of where they're from?
We do, Rosemary.
Yeah.
Jan is acknowledging where she's from in the Kingston Peninsula in New Brunswick.
Great.
Thank you,
Great.
Jan.
So please feel free to, respond in the chat line if you want to say anything. Someone from Clinton, Ontario. Good morning. It's early for you, I'm sure. So I want to get started. We have a wonderful array of presenters today. So our first presenter is Karen Lake. And Karen is a registered nurse who has worked as a caregiving consultant and a navigator in independent practice, providing support for families in the Fredericton, New Brunswick area for nearly a decade. Her work focuses on helping caregivers understand the complex senior care system to help them make informed choices, to be prepared and confidently navigate the multiple challenges and the issues that come with caring for a family member. I'm going to pass it over now to Karen, who can tell you more about her work and start her presentation. So welcome, Karen.
Thank you, Rosemary. I'm assuming you can see that okay?
Yeah, that's great.
You
Looks
can
good,
hear me
Karen.
okay? Awesome.
All good, Karen.
Thank you, Tanya. Hello, thanks for that nice introduction, Rosemary. And thank you to Rosemary and Tanya from CHEN for the invitation to join the conversation today. As obvious, my name is Karen Lake, and I'm entering, I don't know, my 30th plus year of nursing. Seeing all the grad pictures is kind of exciting, but it's a bit nostalgic and brings me back a lot of years. I am a registered nurse in my 10th year of working independently in my nursing practice as a caregiving consultant and care navigator. I firmly believe that caregivers have a vital role to play when it comes to supporting their family member, and they contribute billions of dollars to our care system. And so, for the last 10 years, I've made it my mission to serve and support families and the family members who they care for as a caregiving consultant and care navigator. So what is a navigator? Navigating is not a new term. People have been trying to figure out the care systems for too long. Am I right? More recently, we're seeing the word navigator, someone who's in the role of coordinating care. But it can mean different things to different organizations. But one common denominator that navigators have is we share our knowledge, our experience, and our expertise to help people navigate what can be a very confusing and convoluted care system. Personally, I pay extra attention to having conversations where my clients get to ask direct questions and get definitive answers. I assist them to work through the struggles and the overwhelm and get them linked to helpful resources in the community. We identify gaps in the provision of care, working to enhance their support system, which I like to call their care team. And I'll get back to that term a little bit later. Personally, this is why I feel nurses are so uniquely positioned to provide navigation. I feel that we provide the continuity, the warmth, the trust that people need during challenging, emotionally charged times in life. Motivated only by seeing our clients and their families survive and thrive through what can be a devastating or difficult time. For those not familiar with the term, a navigator is a skilled and seasoned healthcare clinician who specializes in helping individuals and families anticipate and navigate all aspects of health that may arise as we age. Myself specifically, I specialize in the area of community and home health. And I'll share with you the principles that guide me and how I practice as a care navigator. For myself, as a navigator, I work to serve and assist families as they face Sorry, I just lost my presentation for a moment.
It's still on the screen, Karen. All good from this end.
Okay, but I can't see the script. Strange.
In your presenter mode?
Yeah.
Yeah. Give you a second to locate it.
It was there and now it disappeared again.
Oh.
That is so strange.
Yeah.
All I see on my screen currently is who's participating.
Could it have been minimized?
I don't know.
Can you see your slides?
I can't see my slides at all now. I can just only see the participants.
Oh. Maybe, Karen, if you just stop the share, joys of technology. Yes, Jane, exactly. Stop the share and then reshare again.
Okay, it's back.
It's back. Excellent. There we go.
Thank you to that tip.
Yeah, a little reboot there.
Okay, where was I? Working to serve and support and assist families as they face age and health-related challenges. I conduct professional assessments, recommend services and programs, and provide ongoing support to arrange these services. I provide monthly care management and support. This is an important one, bringing skilled knowledge, experience, compassion, and calm to a time of crisis. Assisting clients and their families to plan and prepare for the long term. To serve as an expert in the field, providing knowledge, resource, and advice to clients, families, stakeholders, and the general public, and so much more. Honestly, 2 days are never alike, but that's what keeps it fresh and what keeps me excited to do the work that I do. So why my focus on family caregivers? There are actually more than 8 million family caregivers in Canada. And I honestly think that number is on the low side because many people do not identify as a caregiver. And so I suspect that number is higher than 8 million. Due to healthcare restraints, the Canadian system relies heavily on family members to help those who are aging, ill, or disabled. Some caregivers provide over 30 hours per week of support. 75%, or about 6 million, are caring for an older adult. About 39% are caring for an aging parent, and about 8% are caring for their spouse or partner. 70% of the care for seniors happens in our community and is supported by their family members. Now, these statistics are not up to 2025, so I suspect these numbers could vary a little bit. Caregiving is not easy. Its intensity increases as the health of the family member decreases, is discharged from the hospital, or receives a devastating diagnosis. It can lead to financial loss, job loss. It can result in a decline in the caregiver's own physical, emotional, and mental health. It can be taxing physically, emotionally, mentally, and financially, because the work is unrelenting, hard, and requires tremendous sacrifice. There is generally a lack of federal and provincial benefit, and coupled with not a great lot of flexibility in some workplaces for absences or flexible working hours. There's a lack of awareness of resources and limited resources in a system that is challenging to navigate. I'd like to share this quote. Oh, sorry. There's my little reminder about the 8 million family caregivers in Canada. I'd like to share this quote with you from the late, great Rosalind Carter. Some of you may have seen and read it before. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be a caregiver, and those who will need caregivers. I'll just let you read that again, and maybe you can identify where you are on that spectrum. And so the question becomes, why would we not support family caregivers? When we support people to navigate, we're encouraging people to be informed, to be educated, and to feel empowered. I believe this can lead to better health outcomes for everybody. Families and their caregivers need and deserve answers. They need to be supported and encouraged to advocate for themselves and their family member. They need to be encouraged to take action, to ask questions, and to demand accountability. This is not always easy, especially when you or your family is dealing with a devastating diagnosis or health crisis. Because life is fragile, isn't it? We may be fine, and things can change drastically with an accident, a hospitalization, surgery, a stroke, cardiac event. And for some, the health may decline over time. Something like dementia, Alzheimer's, neurological disease like Parkinson's or ALS. Whatever the challenge, I want to share with you my 6 tips for navigating care for yourself or a family member. And hopefully that sounds okay. Number 1, conversations. And this was intentionally put as number 1. I encourage clients, caregivers, the families that I work with, and I'll encourage you to have those deep and difficult conversations that are required when we are discussing our health and our long-term care. It may not be pretty or polished, and it doesn't have to be, and it probably won't be, but it should be productive, and you will have to have these conversations more than once. It is plural. It will likely be emotionally charged because our health and our closest family members are our most coveted possessions, aren't they? We need to ask and seek answers. What do I want? What can we afford? How do I see myself aging? Where do I want to die? What am I willing to concede on? And what is a non-negotiable? Conversations. Number 2, care team. I've kind of coined this phrase and I use it a lot, and it's caring for someone at home is not something you do alone. The navigator's role is to steer the client and the family through this challenging maze and be able to identify what is most needed and who can help with that. Professionals like a doctor, a specialist, a nurse practitioner, nurses. We have a pharmacist, we have a lawyer here today, and other paraprofessionals and programs like in-home supports, equipment programs, meal programs, etc. Ask yourself, what am I willing, able, and ready to do? What can I physically do? And what can I not do? Who else in the family is able and wants to participate in my care? Who has what different skill set for what needs to be done? And then we go to work at filling those gaps to form, hopefully, a functioning care team. Number 3 is knowledge. I have often heard said, we don't know what we don't know. Knowledge really is power, isn't it? And it helps us to make informed decisions and advocate for our healthcare. We really have to become an expert in our health, in the disease or the diagnosis we may be dealing with. I will urge everyone to be cautious of good old Dr. Google, but at the same time be open to new options. Being hypercritical of what you see, hear, and read, and ask questions. And I admit it's easy to get overwhelmed with all the information that's out there, not to mention other people's thoughts and opinions that can influence us. I encourage all my clients and caregivers to count on reliably sourced studies and researched information. And ask your doctor, nurse practitioner, health practitioner, what sites they follow. Number 4, tools and resources. This is really identifying what do I need and who and what can help me to fill that need. It's essentially all the people, places, and things that make your health journey easier, effective, and efficient. This essentially becomes your toolkit. We need to consider technology, caregiving applications, websites, books, journals, equipment, anything to help gain knowledge and support. Some people have an aversion to AI, but I think it's here to stay and it's not leaving us. ChatGPT is a really amazing source. There's so much information. We have to be creative and really think outside the traditional box and look at what's in your community and some of the innovation that's happening there. And they can go into your toolkit. Number 5, mindset matters. Honestly, no one can take this disease or diagnosis away from you. We are all aging. So this is our journey, and it can be an emotional one, full of a mix of emotions, denial, fear, resentment. A navigator can't take that away. No one can. But we can help create a supportive space for you to work through your emotions and to get to a place where you can acknowledge, adapt, and accept your emotions. three big ones that come up for me are gratitude. We need to dig deep, finding the good thing in each day, one good thing. We need to balance the heavy with the light, joyful parts of life to achieve some level of balance. The second one is patience, because things move slowly in healthcare, don't they? Wait lists are long, and there's not always a quick answer or a solution. We really need to settle in for the long haul and take a long view while still being mindful and in the moment. Acceptance is a big one, especially with a devastating diagnosis or disease. And this one takes time. The 4 keys that I use and that guide my mindset that I'll share with you are being patient, being polite, being professional, and being persistent. Number 6, support and connection. I'll go back to what I said before about care teams. Caring for someone at home is not something you do alone, because illness and caregiving can be isolating and lonely. So we need to include our close, trusted people in what we're experiencing so they know where we're at, and so they might easily involve themselves to help. I often say this to caregivers: we're good at caring, but we're not always good at receiving. So be open to not only giving, but receiving offers of help and asking for what we need. That causes us to really call on being vulnerable, doesn't it? There is much to learn on our health journeys, not only about our life and our health, but about ourselves as a person. I encourage everyone to seek out your circle of support in different groups and organizations, and I can share a few with you. I would invite any family members in a caregiving role to join my virtual group, where we honor and celebrate caregivers, offering them a safe and supportive space, knowing they are not in this alone. I invite you to request a copy of the Aging in New Brunswick, the user's guide. I had the privilege of contributing to this valuable project full of guidance and direction for navigating senior care in New Brunswick. I'll just give you a minute if you want to jot down that information. And another source of support and connection that I'm really proud to have been a founding member and a part of its development, and it's still in development phase, but the website is live, so I'll encourage you to visit that site, is the newly launched Caregivers New Brunswick. It will serve and support family caregivers of the province, strengthen existing community supports, and advocate for policy change and best practice with government. So stay tuned and follow that page for more development. So I'll say thank you for your time and your interest, and we'll open it up for questions. And my contact information is here for anyone who might want to find me.
That's great, Karen. We'll leave that up for a while so that people can make a note of that as well. Wonderful description of the role, what the potential is for people to take advantage of opportunities to work with navigators in the community. These are the kinds of things that I think people don't always realize are available to them. And, when you're, like you said, when you're confronted with a situation that is life altering, it's often really difficult. It feels often like the world is shrinking rather than, people saying, oh, I can reach out to a service or an opportunity. Those are the sorts of things that make it, to provide this kind of information for people gives them that additional kind of leg up to be able to look for where they can find resources as well. I see that there are some questions and some comments in the chat line, and I want to just take a minute to look at these, and we can respond to that. So Jessica says, Karen, your Facebook group is great and very supportive of caregivers. So that's excellent. Yeah. Can you speak a little bit? Not sure again. Jane Van Horn is wondering, can you speak a little bit about the nursing home without walls? Are you familiar with that?
I am familiar with it. I can't really speak to it. That would be better coming from one of the coordinators.
Right.
It certainly is a program that is housed or stationed in participating nursing homes, although it's not really affiliated with the nursing home. It's just sort of housed within. It has separate staff, and each unit, or if you will, each nursing home without walls unit identify what they want to offer their community. So they all differ a little bit. But the best thing to do would be to speak with someone directly from Nursing Home Without Walls, just because that's not my program, and I probably wouldn't give them due justice by describing it.
Yeah, but and it's a really good question because it is something that's quite new,
Mm,
especially in New Brunswick, and it is one of those things. I actually just looked it up, and every community has a site that describes what this is. Yeah, the program is expanding rapidly. So those are the places, but Jane, you're right. Those are the places where people really need to look at communicating. I think your first comment about, communication is certainly a key to getting this kind of information in place. So conversations, finding out more about this is really important. Yeah, for sure. Bridget Bannister is asking, how would you suggest to help a family navigate the system when they don't have a family doctor? A good question.
mm, and a common situation, isn't it? Um, the way we manage it personally, now I have a doctor, praise be. My husband does not have a doctor. I think first and foremost, we have to advocate for ourselves. We need to take care of ourselves. We all have a responsibility to manage our health and take care of our health, so that we can be as healthy as possible. But how my husband manages it without a family doctor for any health related issues is he always returns to the same clinic. There are many clinics, there aren't many, but there are clinics that you can go to. But I wouldn't clinic hop, I guess is what I'm saying. I would always return to the same clinic. Um, I know, just for example, again, a personal example, but he always goes to the Northside Clinic in Marysville, and he always sees Dr. Hansen.
Right.
So rather than like going there and then maybe the next time you have a health related issue, going to the downtown clinic and seeing a nurse practitioner, and then maybe the next time going to the urgent care center, um, that's how he manages it. so that he's at least always dealing with the same practitioner, the same clinic. It's not perfect. It's not ideal. But I suspect the days of everyone having an individual doctor are limited. And we're looking more at a collaborative approach where you are assigned to a clinic. I mean, that's the road we're on, isn't it? That you get assigned to a clinic.
Right.
And you would see that group there.
Hopefully. Right. Right. But I think that's a really good response to that question in terms of, rather than sort of hopping around, at least trying to be consistent with, where you are getting information and how your information is shared. I mean, I think one of the things you mentioned in terms of, tools and resources,
Right.
from the other side of things, from the healthcare side of things, to say that, when we have e-health, so computer assisted health records, where there's information that can be shared between pharmacy, hospital, community, makes life so much easier from speaking from the clinician side of things, makes life so much easier to be able to get information. I don't have to ask that person the story, their story over again. They're not telling their story 15 times. So, as we move forward, I think, and become more comfortable and secure in using those kinds of healthcare systems, that will also help to make things easier. So, yeah.
Yeah. And in the interim, and where I thought you might be going with that, under what I identified as a toolkit or tools and resources, would be a very simple health journal. I know I encourage caregivers and my clients to keep a health journal, especially if you're in a situation where you don't have a health record in a doctor's office somewhere. So every time you have a touch point about your health, whether it's a new prescription or a visit to a clinic or your mammogram, whatever it might be, like keeping a health log or a health journal, so that when you go back to said clinic, that you can update that practitioner with where you're at. So much of it really does call on us to advocate for ourselves, or to have a significant, partner or family caregiver to help us advocate and push forward our needs. Yeah,
Right.
so really, I mean, I'm probably saying that to myself as much as I'm saying it to everybody else about keeping a health journal. It's really important.
Yeah. Yeah, and the other part of that too, I was just thinking when you said that, I was thinking the other thing that's important to keep track of is if a referral is made, and on a personal level, we recently had an experience like this. So keeping track, if your healthcare professional says, I'm going to make a referral to a specialist, you should be making note of when that referral is made and keep track of it, so that if you don't hear anything, you should follow up, because those are the kinds of things that, and I have certainly seen this over the years, those are the things that get lost in the ether. They're just out there somewhere. So, yeah. Yeah.
Yeah,
But a couple,
100%.
yeah,
Follow
a
up,
couple
I think
other,
accountability I had mentioned. Because yeah, things can get overlooked, things can get missed. Your presentation can disappear. Like, these things just
yeah,
happen, right? We don't expect them, we don't predict them, but they can happen unexpectedly. So this is sort of the advocate role, the accountability, the taking action role. That's difficult because the system can be intimidating.
yeah,
It can be an intimidating place, especially if you're not feeling 100% and you're dealing with something very serious. That's why it really does take that care team, doesn't it? Because you need that circle of support around you
yeah,
to
for
kind of
sure,
hold you up
for sure.
and,
There are a
and
couple
get
of
you through
other
that.
Sorry, there are a couple of other questions and comments in here that we can speak to. And again, I'm not sure if you can respond to this, but I'm, given your connections, the question, Jody actually asked this question, what is the state of hiring caregivers? So both organized and private. Can you respond to that?
Does she mean like a paid caregiver, like a personal support worker? Is
Nodding
that
her head, yes.
what was it?
Jody's nodding her head, yes.
Oh, okay, I see. Um, well, there are organizations that offer, like agencies, if you will, that offer in-home support in the way of a home care worker or a personal support worker. It's not immune to human resource issues like other organizations. We know there's a shortage of healthcare professionals and paraprofessionals. Um, and so there are care agencies. Sometimes people will ask me, which one do you recommend? But they generally all operate the same. But what I often tell my clients is we need to find that diamond in the rough. We need to find that person that matches well with your family. And that person might work for one company or another. And this may be where the patience piece comes in, because, and I often say this to my clients, like we need to be patient, because sometimes the first person that comes to your home may not be ideal. So we need to go back to the books and try a different individual. I don't like to just give up just because the first person who came wasn't a good match. It really does take patience, right? But they have shortages as well. I think they do the best they can with what they have. And they work really hard to improve the sector. Um, but they have their struggles. They have their struggles. Jody, I worked in that area for the bulk of my career. So it definitely has its challenges. As far as hiring independent people, that really takes that connection piece that I talked about of like staying connected in your community, perhaps your church community, asking other individuals, who did they hire? Like, so it would come more as a word of mouth referral, which is very valuable as well. But people have the option of seeking out support through an agency or independently.
I
Each
think
one
the
has
other,
its challenges, but it takes patience to find the right individual either way.
yeah. And I think what I was going to add to that is, one of the places again that navigators are navigators function often as brokers. So as a broker, you are and I certainly know from spending time with you, Karen, that this is something that the connections that navigators have in their communities means that they also often have those kinds of resources in their back pocket. So that's where those things are helpful. People don't have to struggle alone. I think that's something that's really valuable in terms of those navigation roles. And I noticed that, certainly the comments about, we need more access to healthcare workers and when the hospital is 50% full of people in transition, I mean, we know that these are certainly problematic areas that we need to, and that's one of the reasons that we're talking, is that we are not yet at a place where people are adequately resourced, I think is really what we're looking at. And finances play a big role in whether or not what somebody can actually do. However, that being to speak to your point, I think there are also a lot of opportunities for volunteer organizations for, ways to access that kind of those kinds of resources safely. I think that's the other kind of thing as well, that we need to, yes, Jane, you're saying here, people need to be empowered, just, catching on your kind of final comment here as well. And that's really great. I mean, there are a lot of comments and we can certainly, please continue to post in the chat line. as we move forward. But we're aware of the time as well. So I want to really thank you, Karen, for your
You're welcome.
presentation. And I think, like I said, there will likely be more opportunity towards the end of our symposium today, where we can have a little bit more conversation. Tanya and I will be keeping track of the comments. So we really appreciate that. And I know the other thing that we forgot at the very beginning, was to get a sense from the participants. And we have about 25 people on board here. Just wondering if you can give us a sense of the area that you work in, or what prompted you to come on to this. Tanya, do you want to add to that in terms of question more
Yeah,
specific?
and perhaps the people who've joined us are caregivers or family navigators, other healthcare professionals. Just let us know who you are. Yeah. Or let the whole group know who you are if you'd like
So
to.
just put that in the chat line if you could. That
Yeah.
would be great.
Yeah.
Yeah.
Someone who works in oncology and education as a pharmacy technician. Hi, welcome. Wonderful.
Someone with family
Uh,
members,
and family members in the hospital for 2 months. Someone
staff,
from the monk. Sorry,
educator.
Rosemary.
Yeah, no, I'm
Yeah.
over talking you. Yeah, sorry.
We're
And
excited to have everybody here.
yeah, we really are. And we're going to get ready to have our next presenter, Greg Mackay, who's the pharmacist, who is our compounding pharmacist that we're going to have present shortly. So Tanya, are we queued up
Yeah.
for Greg?
Greg is here, yes. Oh, someone said I recently retired and now volunteer with
Oh,
One
that's
Care
excellent.
Services. That's great. And a former RN in a nursing home, now retired, now a caregiver
Yeah,
in the
that's
8% category. Yes.
I do.
Yes.
I
Yeah.
I will also give a plug for, if you can
Mm-hmm.
see, whoops, where did I go?
Oh,
If you can see my
mm,
screen, I also have a copy. I have a hard copy of the Aging in New Brunswick, a user's guide. And as Karen mentioned, it's available online. It's an excellent,
mm,
it's an excellent resource. So that's something that is available to everyone, in the province, certainly, and elsewhere. So I would really encourage you, because it covers so much of what people need to, where people have questions, and what they really need to know
mhm.
about. So that is
Yeah,
something that I would definitely encourage people to get a hold of, as well as the other resources that Karen has mentioned in her presentation. And remember too that we are recording this, so this will be available after the fact on our YouTube channel as well.
right, right. We've got 2 more people who put in some info. We've got an RN who is a private companion, educator, and consultant at DECH, and someone in foot care in the community and helping seniors navigate home care and the struggles of no family doctor. Seems to be a recurring theme right now,
Yeah.
unfortunately. Yeah. Thank you for letting us know. And I'll pass it to you, Rosemary, to introduce our next speaker.
Great. Okay. Well, thank you so much, Karen, and everyone for commenting. We really, this is what we wanted to do. We wanted to be able to set something up where there could be these kinds of conversations. I think this is what's really important. So I'm really happy to introduce you to Greg Mackay, who is the pharmacist from Keswick Compounding Pharmacist. He's the owner and the primary pharmacist there. Greg works closely with patients, families, and with healthcare professionals to ensure safe and effective medication use, particularly for older adults. He's passionate about making medication management clearer and more accessible. So now I'll pass it over to Greg, who can tell you more about his work and start his presentation. Welcome, Greg.
Hi, how are you doing this morning?
Great, great.
Screen sharing coming up there, okay?
It
Yes.
is, Greg. We
Okay,
can see you.
perfect. Okay, sounds good. Just give you a little bit of background about myself. Let's see, there you go. So I had my first degree from Mount Allison University in Sackville, New Brunswick. That was back in 2004, and then moved on to the College of Pharmacy at Dalhousie in 2009. After completing my pharmacy degree there, started working in the St. Andrews, St. George, Campobello Island area between three Guardian pharmacies there for about 3 years. And I grew up in very much rural Nova Scotia, so most of my work as a pharmacist has been in small rural communities. So after being there for about 3 years, my wife and I, she's also a pharmacist as well. We moved to Fredericton to start raising our family and worked at Jean Coutu on the north side of Fredericton in Devon for about 11 years. And then in May of 2023, moved over to owning Keswick Compounding Pharmacy. So as a pharmacist, our role has changed significantly since my career started. All of the common things back in 2009, filling prescriptions, the refills, getting hospital discharges at that point, which seems almost a little bizarre now, we were not doing injections. That was kind of like drinking out of a fire hose because right after I graduated, we started doing flu vaccinations. That was when H1N1 was also a vaccination campaign going on. So we were taking that training course, and then it was, you were doing hundreds of injections in that first year. So everything from doing the injections, doing medication reviews, solving insurance issues, dealing with inventory problems and drug shortages have been a major issue over the past year. But now what's really coming to the forefront is pharmacist prescribing. I'll hit on that a little bit. Some things that we do that are a little bit unique out in Keswick. I won't spend too much time on this because it's not a marketing campaign. We do some specialized pain and wound care treatments. We also do some customized medications for pediatrics, for veterinary medicine, as well as hormone replacement, which is pretty unique to the area. And also we deal with some of the dermatologists in the area. So a lot of people think the compounding world is for everybody else. But once people come to see either myself or Adam or other pharmacists, they realize, oh, they might be able to solve a problem that I've been dealing with for years. So it's not just veterinary medicine, it's not just pediatrics. Sometimes it's a patient who's been on a waiting list for 6 to 12 months for carpal tunnel surgery, and they say, "Oh, I just have to deal with the pain because I can't take anti-inflammatories. I don't like how opioids or morphine or things like that make me feel, and I just have to put up with it." And then we tell them, "Oh, we can actually make something for you that's unique. We can make a cream, we can make a gel for you that you can use that can get you through to your surgery date, that will help you with your pain management." Or in the pediatric world, they don't make tablets for 2 and 3-year-olds, or they don't make heart medications for 2 and 3-year-olds. So that's where we come into the fold there. And we can make kind of customized solutions for those problems. And some other things we do, just because it's such an oddly competitive world out there now in healthcare, you have to differentiate yourself. My wife Lori, she also does our hormone consultations at the pharmacy, and we're, to the best of my knowledge, the only pharmacy that's offering that service in the Fredericton area. And we also have our front store manager does fittings for ladies who've had mastectomies. She also does compression stocking fittings, and has some specialized training in wound care as well, which really helps set us apart, and again works into that problem solving phase that if you don't know the resources are available, you may not know where to go. So we're really trying to get the word out there that these aren't problems you just have to put up with over time. There may be resources that can help you solve those problems. Now, moving into the minor ailment piece, this gets mentioned a lot in the media, but there's also a lot of confusion around it. So I think it's relatively well known in New Brunswick that yes, pharmacists can prescribe for some things, but we do spend a fair amount of time explaining to patients what's covered by the government, what's not covered by the government, how the whole service works. I think people are getting more comfortable just asking, and that's okay. So currently, there's over 30 common conditions, and they are changing the wording. They're changing it from minor ailments to common ailments now. That's still in a transitional phase. So the things that we see patients for the most right now, by far, is uncomplicated urinary tract infections. So we have a nice form we have done up at the pharmacy. So if somebody calls us and says, listen, I've been going to the bathroom more frequently, I'm having abdominal pressure pain, maybe not necessarily pain, but I think I might have a bladder infection. Most people or most females that we're seeing have had them before in the past. They're pretty familiar. They're pretty good at self-diagnosing, but we still have some red flags that we always question just to make sure it's nothing more serious. We say, sure, come on down to the pharmacy. We'll go through that form, go through your symptoms, check your current medications, and then that whole assessment process maybe takes usually not a lot longer than 10 minutes because we have things pretty streamlined with our documents that we have ready. And then we can write a prescription, which patients are allowed to take to any pharmacy for convenience sake. Most don't for obvious reasons. And then we can fill the antibiotic on site. So instead of a patient going to a clinic, going through, I mean, you can easily add this up in your head. If you go to the hospital for that, you're going through the person at the front door, probably somebody working security. You had to register, go through admin staff, go to the ER unit, probably see another nurse, and then probably see a doctor after that. You've probably gone through at least 5 people before you've even ended up with the prescription in your hand, let alone still then having to go get it filled somewhere. I can't say that we've often had any sort of criticism that this is self-serving or driving some sort of profitability model or something for pharmacy. I can't say we get that criticism at all because most people just find it to be quite easy and quite efficient. And I'd say there's probably 10 to 20% of cases that we make that assessment and we do refuse to prescribe because we either feel that, this has gone on too long and you may have a kidney infection, and you really do need this assessed by a doctor and nurse practitioner, or this is a repeat case and you really need to get this looked into. So it is a pretty thorough evaluation, I feel. And the government, which it was wise to set it up. I mean, we do bill a service fee to the government, and we do have that service fee whether or not we prescribe. So it's not like a system where we only get paid if we write a prescription. That's not the case. It's for the assessment itself, similar to if you went to see a doctor and he said, go home and take some Tylenol. That's still a billable service. The other services that we are providing now a lot more would be for tick bites and Lyme prophylaxis. Our pharmacy is in Keswick. There's a lot of woods. There's a lot of tall grass. There's a lot of people who are outdoors a lot, walking their dogs, going fishing, working on farms, or just out mowing their grass. So we're probably doing a tick assessment I'd say we're probably doing at least one every 2 weeks, which doesn't sound like a lot, but it just depends. Hopefully people are taking the right precautions. We also do a fair number of shingles assessments or assessments for cold sores, not so much for pink eye or acid reflux or impetigo, but again, the list is growing for the things that we can do those assessments for that are covered. Now, it does get confusing when there are things that we can do the assessment for that are not covered, which would be this extensive list. And I guess that does cause some confusion because a lot of these things tend to be quite minor. And they're things that I guess it's a service that pharmacists have just openly provided and assessed patients for years. Included on that list is upper respiratory tract conditions. I have never charged a service fee for a patient that's come in and with cold symptoms. I don't think I'll probably start. I know there's pharmacist run clinics in other provinces, and I guess it's a bit of a slippery slope. I know some will present it and say, if you'd like to self-select these products, here's where they are. If you'd like a more detailed consult, come into this office and we can go through things in more detail. But it's a bit of an odd setup, and I understand how patients get confused if they see this list, because most of these interactions are a minute to 2 minutes. If someone has a hornet sting or mosquito bites, we can easily guide them in the right direction without doing any sort of a really formal consult. Now there are some things on that list like oral fungal infections or thrush, or even treating some fungal infections of the skin, or some and even headaches or people dealing with migraines. Yeah, if we're getting into more complex cases, we would be referring anyway. So if we're treating with more than your general over-the-counter options, that being said, it does help to stop in and ask the questions and look into it, because we do have treatment options available. And I've somewhat joked with other pharmacists. I said, wouldn't it be great to jump into go up to the Chalmers Hospital some afternoon or evening and start asking people, what are you here for, and playing triage, just to see how many things or how many patients are there dealing with problems that could probably be dealt with at a community pharmacy. So there were also some pilot sites set up, 6 of them in New Brunswick over the last year. A couple of those were in the Fredericton area, where they were able to have pharmacists assess and prescribe for strep throat. Those were quite popular because there were some kids get extremely ill in the Maritimes with strep when it's gone untreated, and completely, like, having 2 boys of my own, 10 and 12, and working 40 hours a week. You understand where people get busy, and you hope things get better, and you try to treat things on your own and may not seek medical attention until things get really bad, which is a really dangerous direction we see things going. But their clinics were able to assess and prescribe for strep throat. They were also able to do disease management for diabetes, for asthma, for cardiovascular disease, and COPD. So we would have prescriptions faxed into our pharmacy from a pharmacist, and the patient would have had an existing case of hypertension or high blood pressure. They would go to the pharmacist-run clinic. They would check their blood pressure, their heart rate, look into their lab work, and they could make adjustments as necessary, which was very popular. Same thing if they had COPD or asthma, they'd review their technique with their inhalers, see what inhalers they were using. And again, the government for that period was allowing those pharmacist care clinics to bill as a service, so that these patients did not have to go to outpatient clinics or tie up ER waiting rooms to get adjustments in these medications. Same thing with diabetics. They were able to make adjustments in their insulin. They were able to adjust their diabetes therapy. However, that pilot project ended in February 2025 with the new government change, and funding was pulled. So currently those clinics are still operational, but they are charging a service fee to the customer to have those services done, which makes sense, because you can't expect anybody to work for free and provide those services. It was just really unfortunate, because the because it was such a success at the time, and patients were able to have another avenue. It's still there, but I really don't feel that they should have had to pay to pocket. I think everybody in the pharmacy world was really hoping to see that project grow and continue, just because it, like I said, by the time you go to a hospital and you're going through 5 and 6 employees, whether that's practitioners or security or admin, just to get to where you're assessed and get a prescription, to be able to have that done, what I feel is far more efficiently for these things that can get managed through someone with that background and training. To me, it makes a lot of sense. We would also get questions from patients, though, who would come to us and say, "Oh, I heard pharmacists can prescribe for these things, and you can write my prescriptions for them, right?" Or they would know that we're able to extend prescriptions, which we are, which we do all the time, every day, probably dozens, for obvious reasons, either for patients who cannot get into their regular prescriber, doctor's only in, they're not answering their phones or can't get a reply. And we've reviewed their blood work, their therapy's been stable long term. We can extend their therapy for a while. So they'd say, "Well, if you're able to do this for me, why do I have to go there?" It's made things a little bit muddy for patients. So I'm hoping in the future that line of communication can get opened up between pharmacy and government and really give this whole program a thorough review and revamping, because I think there's a lot of potential there that just, it's clearly been explored because the pilot project existed, but I just don't feel like it took a step in the right direction. So this is a big part of our day now, and it's a question that I expected to get asked a lot, in this group and through this presentation, is where do people go? So we have a sheet done up at the pharmacy that has a list of options for patients, and none of them are perfect. I'm pretty blunt with people. So if someone comes in and they have perfect example, from the past week, someone comes in and they have an eye infection that's more than just pink eye. We say, okay, this needs to get assessed, but you probably don't need to go to the hospital for it. We might direct them to the urgent care clinic on Brookside. So that's for more acute issues. If somebody has a skin infection, that's not something that we're able to assess and prescribe for, but they probably don't need to go to the hospital for it. For a patient who's recently lost their family doctor, we make sure that they've registered with NB HealthLink. Now that, again, being very blunt, has been a dead end for a lot of patients, or they haven't heard anything back. I think it's really important, where we were discussing earlier, that patients do advocate for themselves, and if they haven't heard anything, to follow up. NB HealthLink does have an office in Fredericton. I believe it is still on Smythe Street. If you go into Superstore and you go up the stairs, that's where the NB HealthLink office, their main office, is still, to the best of my knowledge. So if somebody's having trouble getting through by phone or getting answers, they do have staff there. So if somebody's wondering how that system works or how it's supposed to work, we definitely have seen patients come off the waiting list, how that's selected, and how people are getting family doctors. I'm not sure how that's actually selected or how they prioritize that, but we do see patients getting family doctors. It's slow, with the amount of doctors that are retiring in their practice. Now, another service that patients are sometimes not aware of, if they do have a private insurance, a lot of those private insurances now do have a phone app. So I know for myself and the insurance we have through the Chamber of Commerce, instead of going through eVisit NB, some private insurances do have a 24/7 service through through the app on the phone that can put you in touch with a doctor or nurse practitioner. It's often 24/7, 365 days of the year, and it's usually free of charge through your insurance provider. And a lot of patients are not aware that that exists through their own insurance. So that's something that can sometimes help. Outpatient clinics, yeah, they're very difficult to navigate, but we'll usually I feel like we're almost playing the role of doing that triage for patients, just depending on what their needs are. Now, prescription refills, most of those were directing patients to get set up with eVisit NB. Same thing for blood work. This is somewhat new, that patients are realizing that they can book their own, but always the question of, if I don't have a family doctor, who is doing the follow-up, who can take care of referrals for me. So just to give you a bit of an idea of what we do see on a regular basis, where we're in New Brunswick, I always go on the assumption that we're probably looking at around a 50% literacy rate, and that just keeps things in check. I think in healthcare, that you shouldn't always make that assumption that someone has excellent computer skills, owns a smartphone, and can navigate these resources that you hand to them. Every couple of months, myself or Adam or other pharmacists will sit down with a patient, and they've been told, oh, well, here's what you need to do. You need to go through eVisit NB or set up an account through Maple and get your refills, and that's what you're going to do. Well, if this patient is illiterate, if they don't have family in the area, they don't own a smartphone, or if they have limited internet knowledge and skills, you've just asked them to do the impossible. So I have set up a patient's first email address, which you may not think that's a thing, but it absolutely is. And that wasn't that long ago. So we have a consultation room at our pharmacy, and we can just start from absolute ground zero, and we can go from a patient feeling like they've hit an absolute dead end in their healthcare and saying, well, I lost my family doctor. He wrote all my prescriptions for 1 year. I have 3 months left and I don't know what I'm going to do. That's far too common of a scenario that we see fairly regularly, but you can see their anxiety level come down substantially when we tell them, we can help solve this. We can get through this. If we need to extend some prescriptions for you for the time being, granted, there's probably going to be some things that need some lab monitoring and adjustment over time, and we'll help get that set up for them. We may need to set up an email address for them. There's a nice little video that's done up for registering patients for eVisit NB. We did one through our pharmacy as well, just to have another resource to post, just to walk patients through that process. And once the patient has set it up, they have brought their phones in or hopped on the computer, and we've walked them through how to do that. And when they get that first text message back from eVisit, and they say, okay, what can I help you with? And they spell everything out, and then we'll say, okay, where do I go from here? And then they click to send the prescription from the assessment they just did, and I show it to them off the fax machine. They go, it worked. That's always a nice feeling. But it is not a long-term solution, and I really hope that we're not having a disconnect between government and what the reality is in our day. Because yes, and as Karen said, it's really helpful to go back and see the same practitioner repeatedly, so you're not having to retell your story. But that's really difficult to do if you're relying on eVisit. Like you can't really select that same practitioner over and over again. And it can be really frustrating to try to get through to some of the clinics in the Fredericton area, or even outside of Fredericton for sure, just to get that seen to in a timely manner. So my other piece of advice is to get to know your community pharmacist. It's the reality of everybody. I buy my groceries at 3 to 4 different grocery stores in Fredericton, and I can't tell anybody how to spend their money. That's fine. We have patients that get some of their medications with us, and they get other things at another pharmacy in Fredericton. That's fine. But it certainly helps when a patient comes to us and I know their medication history, I know their family history. I can go online, and if it's requested or if it's necessary, I can pull up their lab work. I know what sports and activities they're involved with. They've kept track of all of their allergies. I know what their upcoming surgeries are. I know what their other medical conditions are, and we've helped them through making their major health decisions. So when they say, I need help with X, Y, or Z, it makes it a lot easier to fill in the blanks and help things along. So yeah, and anybody who's been involved with healthcare or has had, a major health event, I'm hoping they've had a positive experience with their pharmacist. But I think we hear that a lot from patients, that it's strengthened that bond once you kind of let your pharmacist in on your history and what you're dealing with and what you're struggling with, because often we can help you navigate that a lot better and find some solutions for you. And thanks everybody for your time.
Well, what a great presentation, a great photograph of you and your family. That's wonderful too. I think that we have a lot of comments as you were speaking, there were a lot of comments that people were making in terms of, just the complexity and the difficulties people have in accessing care. And, this is definitely when we talk about the journey that people are on when they're experiencing some kind of health event, or even like you say, when my prescription is running out or it has run out and I don't have a family doctor, I can't get a hold of anybody, what can I do? One of the things I want to point out to everyone is Tanya has put in the link, because Greg, you're going to be very popular with this group. So Tanya has put in the link to the pharmacy site as well, so that, the Keswick Pharmacy, which is a community, it's within the community, the Keswick community just outside of Fredericton, New Brunswick, is certainly, I think, quite a unique place, actually, Greg. I think this is something, compounding pharmacies are not everywhere, but certainly people need to be aware that the pharmacist is a lot more and provides a lot more. The pharmacy provides a lot more service than just, handing you your prescription bottle and your printed handout of what to look for, in terms of side effects, etc. So, these are really, it's important to recognize that. In the same way, I think that we look at different members of the healthcare team to really recognize that their skill set goes far beyond what people often think the skill set is. So pharmacists, occupational therapists, physiotherapists, nurses, health navigators, all of these people have a wealth of knowledge to take advantage of as well. So some of the comments are, so in particular around seniors, and I wonder, some of the, just looking here, there are certainly comments in terms of the pilot project, and that disconnect between kind of the pilot project sort of success and the fact that the funding was taken away for that. Do you have any sense of whether or not that's going to be revisited? I mean, we have a potentially different government. What do you think?
I hope there's enough advocacy on the with the New Brunswick Pharmacist Association that that can get revisited. I know they're starting to drive things towards, talking about like new clinics and having pharmacists involved in these new clinics, but I haven't seen any, and it takes a long time to get a new clinic up and running. And I know pharmacists who have been hired for, say, at the Northside Clinic, but that to me doesn't impact uh, doesn't really impact wait times or impact patients' ability to access a prescriber at this time. So I think, you know, I don't. It's hard to even get. I have been on both the college and the association, and it can be frustrating because it's just so hard to get that line of communication open. But
Mhm.
boy, if people have MLAs, they can reach out to. I know that in the Keswick area, our MLA is very good out there as far as pushing for pharmacist advocacy in the area, which is fantastic. I know he shared that we are doing this talk today. Um, but
Yeah.
that's how things move. That's how decisions get made, is by being vocal. And if you're frustrated with something, boy, that's what they're in government for, is to be listening to the constituents and listening to the patients, getting the word out there. So as much as you know, as having some pharmacists have their voice about it, it is really on the government's end to make the gears turn. So
Right. And the voters are the ones that will make that happen. Yeah, for
yeah,
sure.
yeah.
Yeah. And I think, a lot of the issues that you spoke about particularly in terms of seniors and, access,
Mhm.
is really one of the key factors. And as you mentioned seniors who don't have the computer literacy or
Yeah.
don't have the internet or, are not able to access those kinds of things. I mean, do you have any thoughts in terms of, what are some of the options that you might suggest to care providers or to family members in terms of, helping people access information if they don't have or don't want to use computers.
Mhm. Yeah, so much of it has driven in that direction. Because just to to go through getting, a 3 month or 6 month refill on a prescription, um, for someone who, like I said, we have a number of patients that are not, computer literate. And I said, and I mean, those are real examples. Those are definitely not made up. So we have had them try to book appointments through the downtown community health clinic. They have a service that's called Jump the Line or something to in that regards. Um, but we still have patients that try to reach through that service and find that it's always quite booked up. We've also had patients call 811 and try to have them with a set up a, with an appointment through the downtown community health clinic and try to get help that way. Uh, I believe it's 811 or 411. Sorry. To try to get an appointment that way with the clinic, just because and tell them, hey, I'm trying to do everything right. I've tried this resource and this resource, but can you help me get an appointment set up? So yeah, the downtown community health clinic would be one of the main sites for someone to try to get through on with a phone call, as opposed to trying to do things through an app or through a computer that aren't necessarily comfortable using eVisit NB. But we've helped a lot of patients out start to get comfortable, and it doesn't take all that much time, for us to have them sit down and come in and figure out what they need and help them work through it. But I know that's if they have mobility issues and can't come into the pharmacy, I mean that's a real issue for sure. As patients say, I know I need refills on my prescriptions. I'm trying to do the right thing. I do not have the mobility, or I have medical conditions that prevent me. I just can't go and sit in a waiting room for 6 to 8 hours
Right.
for to get a prescription. I and
Right. Well, it doesn't make sense. Yeah, for
no,
sure.
no, that's
Yeah. Well, and a lot of the issues around transportation, particularly when people are living in more rural, people who live in more rural communities. And
mhm,
that's true across the country that, we see these kinds of things happening. Your comment about, you had a couple of really interesting comments. One was, I really like the idea about, the triage going in and checking on sort of why people are there. And I have to say for myself,
mhm,
I felt the same way when I was at Brookside Mall one day when they had just opened the clinic there.
mhm,
And I'm a former acute care nurse practitioner from Ontario, sorry, but and I don't practice here in New Brunswick, but I really, I thought, well, I could ask every single person who's waiting here why they're here, and I
mhm,
bet you 90% of the individuals who are there could be better managed in a different, and who could be better managed without having to go through this whole
mhm,
procedure. So I think that, really looking at resource allocation. I mean, you mentioned this as well, in terms of really thinking about training, workflow changes, really looking at, the time and resources there. And someone mentioned this as well in in the comments in the chat, that we really need to be looking at a kind of retake on how it is that we provide healthcare in Canada, really.
mhm.
But
Yeah.
that's a huge, it's like trying to turn a tanker around.
Mhm.
It's very difficult to do these kinds of things. But
Yeah.
certainly your presentation has really highlighted how other professionals can be part of the process for people who are really struggling and looking for the resources that are out there.
Mhm. Yeah, and it's for sure on a weekly basis where if someone comes to us and has the conversation and says, here's what's going on and here's the problem I'm trying to solve. Yeah, we get the answer a lot. I didn't know you could do that. Uh,
Right.
so part of that is just marketing again with the services you can provide and just being really open and frank about the discussion. So when we see a prescription for something that we know that someone has gone through outpatients or gone through e-visit, and it's an assessment that we can do at the pharmacy, we'll definitely tell them when they're picking up, saying, I know this is what direction you went this time, and it may have been for a specific reason. Just wanted to let you know, if you're ever in this situation again, come see us. This is probably something we can help you out with. Here's what we can do. Here's what we can't do. Um, here are the services that are covered or not, and they'll kind of, oh, I didn't know, or it's a lot to to have patients aware and know what we can do and what we can't. And and for sure, there are some pharmacies that are still very traditional, I guess, in a sense, or they have limited resources. There's some sites that only do have one pharmacist on staff most of the time. So that does make it really difficult to take someone into a consultation room for 20 to 30 minutes and kind of grinds everything to a halt. So it's not a reality for every site. However, I think you're seeing um, more and more pharmacies say, no, this is the reality. And it's not from a profitability standpoint at all.
Right.
It's purely from just a customer service and a problem solving, and the expectations are so much higher now for patient care, and that's okay because we have the training, we have the resources. So, let's help some people out for sure.
I do have a question for you in terms of the farm, just talking about kind of team and looking at resource allocation. And I know certainly in terms of from a nursing point of view, we're looking at changing some of the abilities that nurses have, increasing their capacity, their scope of practice. And I'm wondering in terms of the pharmacy assistants.
Mhm.
Can you speak a little bit to that? Is that something that is moving into an area where, I'm thinking even of things like injections,
Mhm.
which are, something that pharmacists have taken on. And it can be it's just a lot of time out of a day to provide people with those, flu shots and vaccinations.
Yeah, there's a bit of a differentiation between assistants and technicians. So the assistants would have more of a basic training on data entry, insurance problem solving, just regular prescription filling, processing blister pack medications, where the registered technicians are able to do injections. We actually have an excellent registered technician completing her training from being an assistant to being a registered technician with us right now. She's even coming with us to London, Ontario to take part in a compounding course next week with myself and another one of our assistants. But as part of her training, yeah, she's able to do COVID injections. She did a few at our site last week. She would be able to do a flu shot clinic. She can also do device training. So if somebody says, I want to pick out a blood pressure monitor, sure, she can do that. If somebody's getting started on a new inhaler, once I've discussed with them the therapeutic end of things, she can train them on the device. So that does take a load off the pharmacist.
Right.
Depending on how your workflow is set up, they're able to also do the technical final check on prescriptions. So we have in our software built in, so if someone brings in for very common, say a prescription for an antibiotic, I'll have an assistant enter that prescription. It will come to me first to do what we call a clinical check. So I'll be checking for drug interactions. I'll be checking with interactions with other medications they're on, make sure the dose is appropriate, make sure it's appropriate for the condition they were assessed for. Then if I've given it the okay, that will go through to another assistant to fill that prescription. But that final check to make sure the right pill was put in the right bottle for the right quantity, that can actually be checked by a pharmacy technician. So that can also take some weight off of the pharmacist. So there's a number of pharmacies that operate that way in the Fredericton area, that you probably don't even know that the pharmacist could almost be in a position where they're off in in an office or in a consultation room, and not doing that final traditional prescription checking that was done almost virtually or through the computer system on the front end. And there was a technician doing the final check. So yeah, there are some workflow efficiencies that are probably coming as well. That often comes with a higher volume store, but same thing at a compounding pharmacy. They can be checking the work of the assistants that are
Right.
making the compound formulations.
Right. Oh, that's really helpful. I mean, I think a lot of the things that you've talked about around just the process, in terms of, for example, if someone comes in, what are the things that are covered? So in other words, if you're looking at funded versus non-funded kinds of situations that pharmacists can help out with, it's really helpful to see what that looks like. And also, again, I really just want to reiterate how important it is for people to speak out and to talk to, as you said, this comes out of governments. Doesn't matter where you live. This is part and parcel of funding through the federal and provincial and territorial governments. So it's really important that we make our issues known, and that we also say, I know that this is possible. This is the kind of thing that we want to see more of. You know, the governments really need to know that that exists. So yeah, this has been really great. So, and a lot of you may be you may be getting a little inundated with you know, with people from this from the group that we've been in, but certainly in terms of providing a very interesting and useful presentation, this has been really excellent. So I want to thank you very much for doing this, and hopefully you can stick around so that we can, because I have a feeling that there may be more opportunities for people to speak. But thanks a lot, Greg, for doing this.
And,
I
and in
will,
terms of,
sorry,
sorry,
go.
Rosemary, can I just interrupt for a second? Greg, we had some inquiries about your contact, and I've given them your website for your pharmacy, but is there an additional way to contact you, or is that the best way to?
Sure. Yeah, you can either call the pharmacy, or I can I'll post my my email address in the chat as well.
Great.
Thanks, Greg.
Yeah.
Great. Thank you. So everyone, welcome back. And just want to say that I'm really happy that Jody has agreed to be one of our presenters today. Jody Lee White may be familiar to some of you already. Jody's a lawyer in the Fredericton, New Brunswick area, and you are well known for your work with the Canadian Network for the Prevention of Elder Abuse, a really important organization. Jody has a keen interest in providing information on legal issues that are relevant to seniors and their families to ensure autonomy and dignity. So I'm going to pass this over to you now, Jody, to talk more about your work and to get into your presentation. So thank you very much for being here.
Thank you, Rosemary. I really appreciate the opportunity to talk about my special topic, and that for everyone here who likes to throw rotten tomatoes at the healthcare system, just wait till you hear about the legal system. So I'm an estate planning and estate administration lawyer in Fredericton, New Brunswick. In my legal practice, Wills for the Unwilling, I assist clients of all ages and stages to prepare the legal documents needed for their lifetime estate plan. This includes enduring powers of attorney for property and financial affairs, and for personal care, and also wills, but it can also include healthcare directives, letters of wishes, guardianship agreements, and sometimes involves doing property transfers to streamline the eventual estate administration. During my years in practice, I have encountered many situations that involve some form of elder abuse. So I'm also involved as a board member and vice chair in the Canadian Network for the Prevention of Elder Abuse. We are the only pan-Canadian organization that is currently working to prevent elder abuse. Our latest release is a toolkit available in English and French, Seniors Leading Change: How to Build an Elder Abuse Prevention Network. Tanya, maybe you can put our email or our website address in the chat if anyone wants to check out and download one of the toolkits. Our goal is a fully funded elder abuse network in every province and territory in Canada. I present to many groups on the importance of every individual over the age of majority, which is 19 years of age in New Brunswick, but 18 in Ontario and some other provinces. And everyone should have a valid, effective set of documents in place in the event of incapacity or death. The legal processes that apply if you have a major accident, a serious illness, a fall, a death, almost always involve delay and legal costs far greater than most people will spend over their lifetime to have an enduring power of attorney and a will. And the old assumptions of what people think will happen based on, the experiences of previous generations are no longer applicable. Our laws, institutions, and the kinds of assets we have changed significantly. So it's not just about us, it's also about those that we're responsible for and care for. One thing many clients tell me at our signing meetings is that they feel like a ton of weight has dropped off their shoulders once they sign those documents. Worrying about the what ifs and the what if nots is extremely stressful. Now, I know this audience is multi-jurisdictional, and the laws and legal tools for estate planning are pretty much strictly provincial. So while some of the information I'm giving out today will apply in other provinces, a lot of what I'm going to talk about is specific to New Brunswick. It is important to learn the legal details applicable in your jurisdiction, and this can make a big difference to how your incapacity and estate plan rolls out over the long term. Now, that being said, legislative reform is happening across Canada, so the important principles are being shared. Now, I'm also anticipating that this presentation is really geared towards is usually given to people that are considering this information for making their own plans. But many of the participants in this symposium will be considering this information in their work situations, dealing with the capacity of clients, the decision making that is being done either jointly or with an attorney or other person, or as a caregiver for someone else, in addition to making your own plans. So learning all you can about our current applicable legal provisions will improve everyone's outcomes. My usual presentation, oh, there it is, sorry, missed. Provides the New Brunswick answers to these questions on incapacity and death. What documents are necessary to have in place? Why is it important to have them? What happens if you don't have them? How to make valid and effective documents in your jurisdiction? Who can act and how should they act in the various legal roles? What are their duties and responsibilities? When can these documents be used? Why is capacity important? How does a legal representative make decision? And importantly, how to avoid abuse and conflicts. Now, the brochure for this session said wills, and to be fair, this is the one estate planning document that most people recognize and are curious about. Death sometimes is easier to plan for than incapacity for many people. A lot of will planning information is applicable in the other provinces, and I can fill hours with all the fascinating, to me anyway, details about making them and planning for various assets and taxes. I won't call it bait and switch exactly because a will is very important, but usually by the time it's needed, most healthcare providers and caregivers' work is done, and it's up to the legal representatives, financial institutions, lawyers, and accountants to manage the rest of the process. In fact, a will is the ultimate substitute decision-making tool, as it represents your decisions and written instructions when you are dead and no longer around to change your mind. That being said, there's a lot of things that can happen before that. So my presentation will mostly focus on capacity and the various types of decision-making using least intrusive measures and what professionals and caregivers need to know to support the autonomy and dignity of the person they're dealing with. New Brunswick is currently leading other jurisdictions with a comprehensive framework of unique legal tools that incorporate a continuum of independent, supported, and substitute decision-making principles for persons with a disability or a lack of capacity to make decisions, or both. We haven't figured it all out yet, but there is a very busy group of professionals and organizations collaborating to put in place best practices to support this new framework. First, I'm going to set the stage and make sure everyone knows why capacity is so important. A person needs to have capacity for two reasons. One, they need to have the requisite capacity to make or sign a legal document. The test will change depending on the type of document, and it is a lawyer's responsibility to ensure that the maker of that document has the requisite capacity to make a valid document. Secondly, one needs to have the requisite capacity to make a specific decision on a specific day in a specific context. There are some provincial differences here, but many use the understand and appreciate test. So in New Brunswick, capacity is defined as being able to understand the relevant information as it applies to that person, and be able to weigh the consequences, options, and risks that are reasonably foreseeable. Now, everyone is presumed to have capacity until it is determined otherwise. Incapacity might occur at any time to a person of any age, in an accident, a fall, a sudden illness, such as a stroke or heart attack, or potentially through Alzheimer's or other dementias, or other age-related diminishment in abilities. Incapacity can be temporary or permanent and may depend on the type of decision, the place, and the time that a decision is being made. And a diagnosis of a particular health condition is not determinative of having the capacity to make decisions. And so any lack of capacity has to be determined on a decision-by-decision basis. Now, first off, we have informal support mechanisms. Some people who are not able to manage all aspects of their lives totally independently have family members or a network of supporters, a support network, who are able to provide informal support and assistance with activities of daily living, transportation, groceries, food prep, banking, investments, even executive functions in organizing their lives. And this might be temporary or it might be permanent. Sometimes, though, a mostly independent person will start to encounter practical or systemic problems in exercising their rights and obtaining the resources they need to live their best life. These speed bumps or hurdles sometimes involve the intersection of technology, privacy rights, and difficulties accessing services because of hearing, vision, communication, and mobility challenges. I will say, in support of pharmacists and pharmacies being a very important part of people's lives, is that they are person to person. You go there, you are in person. You can, if they have the time, explain to another human what your issue is. You're not, at this point in time, necessarily having to do it by way of only a phone call or a chatbot. So this is where New Brunswick's new Supported Decision-Making and Representation Act, which was just introduced in January 2024, has added a new tool, which is called the Decision-Making Assistance Authorization. And I have found this tool really helpful in my work with older adults who are able to make their own decisions, but run into speed bumps and hurdles in getting things done. For example, I think the first clients I worked with were a couple in their 80s. They had some mobility challenges, but they had family members able to help them. But one had a member who, one of them was a veteran. He had hearing issues. His spouse had vision issues, and they were having difficulties in working with Veterans Affairs in terms of getting all the resources that they were entitled to support their life independently on their own. And their family member who was helping them was being stymied to some extent because they were being told, no, we have to speak to the member personally. We can't do it through an assistant. So they signed decision-making assistance, and to my knowledge, assistant authorizations, and to my knowledge, they're still living on their own. Their daughter can speak to Veterans Affairs on their behalf when it's needed. So this document allows any adult to choose one or more assistants and give them the legal authority to obtain information on their behalf and communicate their decisions to others. The person continues to make their own decisions using whatever kind of support it is they need, whether it's information or whether it's communicating their decisions. I like these authorizations, assistance authorizations, because they can be used for all or specific financial matters. They can be used for all or specific personal care matters. To be valid, I'm just going to skip ahead here. The decision-making assistance authorization must be in writing. There is actually a legislated form to use. It has to be signed and dated by the person and the assistant, and it has to be done in the presence of a New Brunswick lawyer, because I have certain tests that I need to make sure you have in order to name this assistant who is going to be able to help you. There are specific rules and restrictions for the assistant around their duties and responsibilities and how decisions are made. But the person themselves makes the decision. They select a person they trust to accept the responsibility. They decide what matters they will assist with and how that assistant exercises those powers. Assistant needs to be 19 years of age and someone that you trust. The problem, actually, there is some overlap here, because a person who has an enduring power of attorney for property and financial affairs can actually have their attorney acting as their agent to do the exact same functions. This is a little, can be a little confusing for people, but it's the way that it has always been set up. And so usually when I'm working with clients, we make the decision-making assistance authorization effective for as long as it's needed. And then we switch over to the enduring power of attorney when that turns out to be needed. And it may be needed once the person loses their capacity to make specific decisions. And then the attorney then usually starts acting as the attorney on the next level of supported decision making. Now, this is where it can get pretty complicated. And my favorite answer to most questions is, well, it depends. And it does depend. It depends on the situation, the documents, and the people. Now, the preferable voluntary option here is to have an enduring power of attorney for property and financial affairs, or for personal care, and preferably both. So then your financial or personal care attorney starts acting as a fiduciary. This protects your rights under the law. If those documents don't exist and can't be put in place, the only other option is to file a notice of application with the Court of Queen's Bench of New Brunswick Family Court Division to request that either a supporter or a representative be appointed, and the court is required to find the least intrusive outcome. We're going to touch a little bit more on not so much maybe on representatives, but on the supported decision making is covered in a little bit. So the supporter who is appointed uses supported decision making, usually some form of interdependent relationship between the supporter and the person, while the representative uses substitute decision making only. But both supporters and representatives are required to ascertain the wishes and preferences of the person in making the decisions to the extent they can. The representative is the equivalent of the committee under the old archaic Infirm Persons Act, which has fortunately been repealed and consigned to the dust heap of outdated thinking on disability and mental incompetence. The new act is based on all persons being able to make their own legal decisions to the fullest extent possible, with the support required to make it happen. So we have here just a little bit about supported decision making, and then moving into substitute decision making, where people do have someone else is actually the person making the decision, hopefully after consultation with that person. So decisions, I'm going to go back, actually, I'd forgotten. What the assistant does is what's described in the authorization. They can only request records the assistant is entitled to request. They have to use the information for the purpose it's requested for, only act if the person has consented to doing so, stop acting if it's revoked or they become ineligible. Have to keep records. Record keeping is very important for all supported and substitute decision making persons. And They can be reimbursed for reasonable expenses, resign at any time, and importantly, decline to assist the assisted person or communicate a decision if the decision would cause serious harm to the assisted person. So it's a fairly robust system to give people the help that's appropriate, but not go too far. And equally importantly, the assistant cannot make the decision for the assisted person. They can't delegate their powers. They have to really act for the benefit of the person being assisted, not any other person. So moving from a full supported system, full supported decision-making system to the enduring powers of attorney. And the Enduring Powers of Attorney Act in New Brunswick was completely changed in July of 2020. When the legislation was passed in December of 2019, of course, none of us knew what the next 6 months was going to bring, and it was a doozy. And putting in place an entirely new framework of these documents was challenging, to say the very least. And of course, Zoom became our friend in terms of doing professional development and discussions. So there are two types of enduring powers of attorney, one for property and financial affairs, one for personal care. The financial enduring power of attorney is a legal document that a person makes that gives one or more other persons, called the attorney. And just to be clear, attorney does not mean lawyer, but you give the attorney the legal authority to make financial and property decisions and act for you. It can be used both when you have capacity to make decisions, but may have physical or geographical limitations. Military members on deployment have enduring powers of attorney. Persons with mobility challenges, geographical limitations, being in other jurisdictions where they don't have access to technology to make their own decisions. But it can also be used when you don't have capacity to make decisions. So in terms of a personal care power of attorney, same idea. You make them, you give the attorney the legal authority to make specific personal care decisions for you only when you don't have the capacity to make that specific personal care well-being decision. And it can be, you can have the capacity to make a lot of decisions and maybe not the capacity to make another type of decision. And again, the capacity determinations are very temporary, permanent, may depend on the day, the time, the context in which the decision is being made. Personal care is very broad. It's anything related to the well-being of a person. Healthcare, diet, clothing, accommodation, support services, education, employment, recreation, and social activities. And as we all know, the issue around driving, which is a very touchy issue to deal with for persons and their support network, and other safety issues fall in this category. But everybody age 19 and over should have one. I'm sorry if I sound like a little bit of a broken record on that, but when you are told stories or get called to see somebody whose capacity is now iffy, and you're trying to determine whether they are able to sign these documents in places like hospitals that are very contrary to my professional duties in determining them, it would have been so much easier to have had one beforehand. Here's the definition of capacity, and just keep that in mind as we proceed along in terms of how this works on a practical level. Again, important to have them. It allows the attorney to act without delay or extra cost, will avoid adverse financial events, will hopefully maintain your quality of life, and it gives the person themselves the choice on who makes the important decisions, and can, I hope, really diminish family conflict and disputes if they're put in place the right way with the right conversations, as Karen says, about what needs to happen. So here's the information if you don't have one. It is definitely a less ideal situation. And some people, it can be a problem because they don't have someone who is necessarily able to act as their personal care attorney or their financial attorney any longer. And so you may have to resort to having the public trustee appointed in order to act. And it's little, the time consuming part of it can depend. Here in New Brunswick, to make a valid and effective enduring power of attorney for property and finances, we have a very special rule. Has to be in writing, has to be signed and dated by you in the presence of a practicing New Brunswick lawyer who reviews the document with the person and confirms that they have the capacity to sign it. So there is always a statement attached at the end that confirms that information. To be effective, you have to select one or more persons you trust who agree to act. You determine when and how the financial attorney can act. And this is very important to have this discussion so that everybody understands, you know, you've made those documents and when and how should they be used. In addition, what general or specific instructions the attorney is to undertake. And my view is always that you should have appropriate checks and balances to make sure that the enduring power of attorney is being used properly, that your assets are being managed properly, and that there isn't any misuse or abuse of authority by the attorney while they are using it. And I'll talk a little bit about some of the appropriate checks and balances a little later, but usually it can be covered under the not having only one person who is the everything person, that there is some sharing of information, communication with others, oversight by a monitor. There can be a number of different tools that are used to ensure that no one is overly able to undertake actions that aren't reviewed by anyone else. For personal care, enduring power of attorney, it's a little different. Again, in writing, signed and dated by you, in the presence of either two independent adult witnesses or one New Brunswick practicing lawyer who reviews the document and confirms you have the capacity to sign it. The Public Legal Education and Information Service resources on making enduring powers of attorney, their booklet, which you'll see later in this presentation, actually has a form of enduring power of attorney for personal care in printed format in it. It's also available on their website as a fillable PDF. So these can be done by anybody. The two independent adult witnesses cannot be the attorney or their spouse or children. So it really has to be someone that is not part of the decision-making process. Who can act as an attorney? You have to be 19 years old in order to start acting. You can have a sole attorney. You can have more than one attorney acting at the same time. It is strongly recommended to have at least one and preferably more alternate backup attorneys. And for financial matters, it is important that either a sole attorney or a majority of your attorneys be Canadian residents. And this comes from the regulatory tax and regulatory rules around investments and financial institutions in Canada. Who's a good person to ask? Well, for finances, someone you trust who has the financial knowledge, interest, and time to act. And also importantly, if you name one or more persons to act at the same time, specify how they make and implement decisions. And there's a lot of misinformation out around how this happens. It's not a simple only jointly or only independently. There are gradations in between a majority, independently with joint planning. There are a lot of different ways you can set them up to make it specific to your situation and from an administrative efficiency point of view, from a dealing with financial institutions point of view. So what does an attorney do? Well, all or specific property and financial matters. They can handle the same with personal care. They have to follow the instructions included in the document. Importantly, they have to act honestly in good faith, act with reasonable care, diligence, and skill, use your property and assets, monetary and otherwise, only for your benefit and in your interest, and they have to keep documents and records of all their actions. With the property and financial enduring power of attorney, it can be used in a lot of different circumstances. Immediately, during a specific period of time, starting from a certain date, only when you authorize it to use it, provided you haven't limited its use to only periods of incapacity. And this is an important one that I think is not really well appreciated yet, is that you can name in the document a person who can assess your capacity and determine that you don't then have the capacity to make a particular decision. So, and this can include a combination of one or more of the following choices. The financial attorney themselves can be that deciding person, a family member, friend, or other trusted person. If you haven't named anyone, it will be, the default is a healthcare professional, which in New Brunswick is limited for enduring powers of attorney to nurse practitioners or doctors. But again, the capacity in the system to have people who do capacity assessments is very limited. And from a financial and property point of view, there is not yet significant amount of training. There's not much training being done, although I'm going to talk a little bit about some new tools that are soon to be available. For personal care, it only becomes effective for use in two ways. For healthcare decisions, so any kind of treatment decision, is when a healthcare professional, a nurse practitioner or doctor, decides that you do not have the capacity to make a specific healthcare decision. The physicians and nurse practitioners do have training in terms of informed consent for healthcare treatment decisions. They're very good at it. This means that they will continue to use the tests and information that they've always used in assessing whether somebody can make their own healthcare decisions. But for all other personal care decisions, it again can be the person that you name in the document who can assess your capacity to make a particular decision. So the personal care attorney, friend, a family member, friend, or other trusted person, and a default is a healthcare professional. Now, this is where there is some potential in the future that they will extend the ability of nurses and social workers who have special training to be able to do capacity assessments, which I believe is most appropriate in personal care areas, simply because they are understanding of when a person has lost the capacity to understand and appreciate their personal well-being situation and may need some support. But I don't think it's impossible that a family member is not able to do it, because if you're talking about a decision about when a person is safe to drive, you drive with that person, you see how they are able to manage the rules of the road. You determine whether they would be able to deal with an accident or a problem that arose. So I actually believe that, you know, the personal care attorney themselves is an appropriate person to assess someone's capacity to make many of the personal care decisions that are part of your activities of daily life and your personal well-being, provided they understand that it's not a, you know, all or nothing kind of situation. It may be today is a problem. It might not be a problem at a later stage. So this is the other area that I think is really important for everybody to know, both for their own situations, but also as a caregiver, as a professional dealing with people, is how does the attorney make decisions? And this is the New Brunswick rule. It's also applicable in Nova Scotia, but I know it's different in Ontario. So if you, the grantor, have the capacity to make a particular decision, the attorney must follow your decisions. And our legislation, both for decision-making assistance authorizations and enduring powers of attorney, is pretty clear that it means even if it isn't the decision the attorney would make, or even if you haven't made particularly safe decisions at another time, if you have the capacity to make this decision on today's date, in this place, in this context, the attorney has to follow your instructions. I think this is one of the gray areas that is really hard for people to understand. It's often our way that we care for somebody else, and we think we know what the appropriate thing to do is. And so to respect the autonomy of a person making some decisions when you're used to making a number of other decisions for them, can be very hard. If you don't appear to have capacity to make a particular decision, the attorney still has to discuss it with you if it is reasonable to do so. And my view on that is, if you're not in a coma, it's probably reasonable to do that. And then make the decision in order of priority in accordance with your previous relevant instructions. So in terms of previous relevant instructions, if you had indicated that if you weren't able to live independently on your own, you would find going to a particular special care home or nursing home appropriate. You would be willing to go there. For financial matters, it might be around your investment policy. It might be around what charitable donations you want continued, even if you're not able to do it yourself. There are a number of different kinds of previous relevant instructions that any of us can plan for now for the future. Even if your capacity is doubtful, your current reasonable wishes should be honored. Now, how do you assess what's reasonable? And the standard that I most often have heard is that it should be your within a reasonably necessary protective strategy. So from a health point of view, from a safety point of view, from a sustainability of funding or care point of view, that is when your current reasonable wishes should be implemented by the attorney. And putting that on paper and justifying those decisions is definitely one of the things that an attorney should be doing. If the attorney has no idea about either of the first two, then they need to make the decision that you would make given your values and beliefs. So based on cultural practices, religious practices, family, heritage types of decisions, they should make the decision you would make. And then lastly, if none of the above apply, it is your best interests. Now, best interests is definitely the test in Ontario, although in Ontario, the attorney is also required to consult with family members and other supporters. But the best interest test is not the first test in New Brunswick. It is the last test. And yet I hear quite often somebody saying to an attorney, no, you're acting in their best interest. That's all you need to do. And that actually is not the actual way to make the decisions. So this is why sessions like these are so important in educating people. This is a healthcare group. So let's talk about healthcare directives, because there have been a number of different changes over the past 10 years in terms of making healthcare directives. So we used to have a separate document, a separate act with a separate document, and that changed when the Enduring Powers of Attorney Act was implemented in July of 2020. And it has two different ways to give healthcare instructions in advance. One is that you have it's some kind of a document where a person with capacity provides written instructions with respect to future healthcare decisions to be made on their behalf in the event that the person then lacks the capacity to make them. You can include those specific healthcare treatment decisions in your enduring power of attorney for personal care, or you can make a separate healthcare directive at any time in writing, signed and dated, no special form required, no witnesses are required. Now, my preference is always the second one, not the first one. The first one, you've named the person that you designate to make as your attorney to make healthcare decisions for you in the future. But the second one is one that's really important to keep updated, and you don't really want to be changing your enduring power of attorney for personal care once a year as your healthcare changes. So having a separate healthcare directive at any time is really, I think, the better practice for most of us. If you've made one, you should give it to healthcare providers, and they're supposed to keep a copy in your records. If certain circumstances, they should inquire if you have made a personal care enduring power of attorney with healthcare instructions and a healthcare directive, and they should review them and then act in accordance with the relevant instructions in the documents, unless they're inappropriate or not legal. So a healthcare provider is not required to undertake any course of action that they would not have to take if you were having this conversation with them in real time. Healthcare directives should be reviewed and updated annually, and there are some different tools that I have listed at the end for people in terms of making really good ones. But sometimes people make them and they don't they've updated them, but they haven't necessarily indicated what the most recent version of their healthcare situation is. And so it's important to realize that the most recent instructions govern if there's any conflict at all between different documents. So avoiding abuse and conflicts when an enduring power of attorney is used. So there are some different kinds of checks and balances. Primarily, I always think having more than one person who is either acting depending on their ability to agree on what a good care plan or financial plan is, having your primary attorney provide that information and keep the backup or alternate attorneys up to date on your situation in the event that they need to act. Monthly emails, what the situation is this month, is a very useful tool in helping everyone understand what the attorney is doing, what the situation is, and how they can help. But we have an extra tool in our Act. So we have actually a legal position called a monitor, and the monitor then can supervise the attorney's conduct, if they're following the enduring power of attorney, they're managing your assets and finances appropriately. This is one tool that does prevent at an early stage the misuse of the attorney's authority in the enduring power of attorney and any financial exploitation and or personal care abuse. And I hope properly used, it can also assist with reducing family conflict overall. So the monitor has the legal right to visit and communicate with the person at any reasonable time, to request and review all documents and records of transactions, to inform the person as well as other appointed attorneys if they have reason to believe that the attorney's not following the law, the documents, or the decisions that they should be making. And they can also consult with the lawyer to determine whether obtaining a court order to replace the attorney is warranted. So it's a pretty powerful tool. It gives them legal standing to check in. And sometimes friends and family members who are not necessarily the right person to name as your attorney because of their age and their health may be actually a pretty good person to be a supervisor or to be able to speak up if they see things happening that aren't right. So these are some of the other safety measures and techniques. Set up a reporting mechanism. There are records that are required to be kept. I know this is a big surprise to many people, and for many caregivers, how this gets done in addition to all the other things they need to look after is a bit of a head scratcher, but I think there are mechanisms that are good to do, and in terms of having a healthcare record and information. Provide them to you, the monitor, other attorneys on a regular basis. It's also important to note that the executor of your estate is a person who should be able to receive, or that the attorney is required to provide their records for the entire period they acted to your executor, using budgets, automatic bill payment systems, monthly or quarterly reviews. Said there are some ability to, limit debits and withdrawals in certain circumstances. Educating people on the various forms of scams and fraud that we all receive constantly is important. And then from an investment point of view, naming someone other than the attorney as the trusted contact person with financial advisors and institutions. One I haven't added here yet, but I probably should, is that the old way of doing things was to name another person as a joint holder or joint access person on your bank account. So making them a joint owner of your account with you, even though none of their money is being put in the account, they have full access to your accounts. And holding property jointly is risky from a number of points of view. You don't necessarily have the same protective measures that are in the Act. And you are, as your money, but you are also subject to them being able to remove it all, them being, if they have creditors, if they have tax debts, if they go through marital property breakdown, your assets may sometimes be at risk in those circumstances. So before you name someone as a joint holder on a bank account or investment account, consider carefully the risks, consider carefully any taxation, income or other kinds of taxes. There can be some significant negative outcomes with that. So that is a protective and safety measure I should add to this one. So that's kind of the enduring power of attorney, which can be a very, can vary from, full support mode to full substitute mode, and can be very much a individualized for people's particular circumstances. And it doesn't, if it's done properly, everybody hopefully then has the support that they need to be independent and exercise their own autonomy as long as they can, but within some form of a reasonably necessary protective strategy. So the next section is about wills. I don't know, Tanya, Rosemary, whether you want me just to go through, just to flip pretty quickly what's here. People I know will be able to access the video later.
Yeah, I think it's a good idea to, to at least cover the main
basics.
Yeah. This is great, by the way. It's really good. Yeah.
Like I said, things that are fascinating to me, if no one else. So, wills, I think a lot of people are fairly knowledgeable. It's a legal document. You appoint an executor. They are the person that interacts. A lot of people sort of assume it's about what you own, but actually it's a lot more about having the legal authority to deal with every person, financial institution, government organization, or other entity you may have interacted with. I mean, I touch briefly at certain points about digital assets. It's about your email. It's about everything that you do in daily life. There's usually some type of organization on the other side of it that will, without a will, some person will be at their mercy to say why they should be able to do what you think they need to do. Now, I say everyone age 19 and over should have one. Actually, if you're married earlier, if you're a military member, if you, there are a number of special categories. And I think the Wills Act is actually one of the last pieces of legislative reform, not last, but the next piece of legislative reform that they have been working on for the past couple of years. So we may have a new Wills Act at some point in time, but at this point in time, mostly it's persons age 19 and over. We know from the last financial capability survey that somewhere around between 30 and 50% of Canadians have a valid, effective will. It's probably, you're closer to 50% for older adults, and a whole lot less for the 20 to 35-year-olds. But how up to date these documents are is anybody's guess. People tend, I have seen them that go back to the 1970s, 80s. Sometimes they can be effective over a long period of time, but in a lot of cases, the people named have themselves had health issues or died. So it's important to at least look at them regularly and see that whether they still meet your circumstances and your needs. So the executor is the really important person, and they, are the ones who deal with your mortal remains. They deal with your property, your financial assets, moving things along. They will file tax returns for you. They will distribute your assets. If you've chosen the right person, it should help avoid a whole lot of disputes with family members. If you don't have one, this is important to know, then our very aged Wills Act and Probate Court Act means that someone from a list of approved family members will need to file an application for letters of administration with the Probate Court of New Brunswick. You still have to pay the requisite probate tax on the assets to be administered, which are likely to be a lot of them. The judge determines whether that person is appropriate to be your administrator. And that's often not necessarily involving a hearing. It's more of a bench decision. The order of hierarchy is married spouse, adult children, parents, siblings. Common law spouses are excluded from this hierarchy of persons who are approved to become the administrator of your estate at this point in time. Obviously, if everyone else before them agrees, that can be done. But there are often situations where there's some acrimony between the common law spouse and the parents or children. So that can be a difficult situation. An administrator resident outside the province will have to post bonding. I know bonding is actually required in certain other jurisdictions, even from an executor that is resident outside the province. So knowing what the rules are in your jurisdiction is really important. There's also a statutory scheme of distribution between spouses and children, parents, siblings, nieces, and nephews, or further remote family members. So if you have minor children, if you have a spouse and minor children, the statutory distribution in an intestacy is that the spouse gets all the marital property, plus if you have one child, half the remaining assets, and the minor child is entitled to the other half of the non-marital property assets, and that gets held in trust for them until they turn 19. So if you don't have a will and you have minor children, I really strongly recommend that you find a way to make that happen sooner rather than later. If no one's able to or willing to make the application, a trust company, the public trustee, can be appointed by the court. I will say the public trustee has a significant workload for all of the other things that they are required to do. So they may decline. They can very often only act in very limited circumstances. So it's not a guarantee that that will happen. But the process can be more time consuming, expensive, and taxing for everyone involved. And your bank account remains frozen. So, you know, bills aren't being paid in that period of time. Making a valid one, there are a couple of different ways. It has to be in writing, has to be signed and dated at the end by you. Now, if you are able to, you can make it all in your own handwriting. This is a holograph will. You do not need any witnesses. You simply have to be able to write it out in its entirety in your handwriting and then date it and sign it at the end. And presumably there is somebody around that is able to swear that that was your handwriting. If it's typed, you need 2 independent witnesses, and all 3 persons must be together at the same time to sign the document. So it's very important to follow those rules. The right executor, like the person you name for your financial attorney, you know, should be a Canadian resident, should be trusted, have the financial knowledge, interest, and time to act. And thinking about what assets you have and what kinds of activity, what kinds of things they're going to need to do is often a good way to think about who the right person would be in order to act. What you own, how you own them, and any rights other people may claim to them are key questions. So we often own property jointly with a spouse with survivorship rights. Those are transferred automatically to the joint owner. There's no requirement that you have a will for that to happen. Any registered investment accounts or life insurance where you've named beneficiary designations, those pass outside a will as well. But bucket 3 is assets that pass only by will. So any other property or accounts owned by you, registered in your name, or owned with another person where there aren't survivorship rights. So owned as tenants in common, such that each party's estate keeps their share and it passes through their will, or you're simply holding property as a bare trustee for another person. These are all the tricky little things that, of course, I think are so interesting. With your beneficiaries, so you need to think of the what ifs and the then what. So where do the personal effects go? Are there cash legacies and bequests? The residue, everything that remains in the estate after debts and taxes are paid and specific gifts are distributed. Who are your main beneficiaries? But what if they predecease you? Do they leave? Have they left children? Does it go to other siblings? What is your kind of longer term plan if something changes and you aren't able to make a new will? So are there gift overs? Do you have charitable donations? Do beneficiaries receive their gifts outright? Are trusts involved? If things are held in trust, as they often are for minors, there are extra costs and administration issues that need to be considered in terms of the timing of what they get and when they get it. Minors under 19 should have guardians appointed for them and trusts set up. There's often questions around family members with disabilities and how money is held for them depending on their capacity to deal with it or not. And then the hardest what if is the common disaster alternatives. So if you, your spouse, and your children are all killed in an accident at the same time, what happens then in terms of your family situations? So having the right guardian and agreeing with your spouse who they are can sometimes be a significant source of discussion, but it's much better if you have them. If you've named a family member and their spouse, consider what might happen if they separate or divorce. Probate is always the question everybody asks, trying to avoid it. All it is a validation that the executor is properly appointed and is able to receive the funds from financial institutions and from a purchaser of property. And it is not always required with spouses, but it is usually on any intergenerational passing. So the death of the surviving spouse is often when your executor will need to apply to the probate court to get it certified. And this does require filing an inventory, swearing to the value of the estate, and paying a probate tax. Now in New Brunswick, it's $5 per thousand of probated assets. Nova Scotia, it's closer to 16, Ontario 15, BC 14 or 16. So it can be in Alberta, I believe it's I think it's just a flat filing fee there, maybe Manitoba as well. So it's important to know what the rule is in your jurisdiction, but there are assets that are excluded. So joint assets with rights of survivorship, mortgage debt on real property, real property located in other provinces, and life insurance policies or registered accounts with beneficiary designations, so TFSAs, RRSPs, etc. Executor's compensation should be discussed with the executor if they're doing the work. Some estates can be a lot of work, some estates are less work. How they get that compensation after they do the work will depend on what you put in the will. It will, they may need to pass their accounts in front of a probate court or get usually the permission of the beneficiaries to approve an amount. There are no set fees, there are some guidelines, and it's always important to know that the executor's compensation is subject to income tax and withholding requirements, so they must include it in their income. And so updating 3 to 5 years, if there's a significant change in your personal status, you get married, that usually revokes any will you've made prior to that. That may change in the new legislation, fortunately. Relationships, children, family situations, real changes to your financial assets. And this last block is the most important. So organizing your information for your executor. Have a workbook or a document. There are a number of really good ones out there. You should, of course, have asked your executor and your attorneys if they would act. If they do, make sure you tell them where the original documents are. Are they in a safety deposit box? Are they in a home safety deposit box? So consider then what happens in the event of fire, water damage, flood, theft, but they should know where your originals are. And you should take the opportunity to talk to them about what your wishes are, what extra things that aren't in your will that are important that they undertake or do. And so make it easy for them to step into your shoes. Do not make somebody go through boxes in your garage to find important information. Keep it organized and updated. Now, these last couple of slides, here are the booklets that Public Legal Education and Information Service have published here in New Brunswick. You can call them or find them online at their new website. There's a link to it at the bottom, but they're pretty easy to locate. The first one obviously is on making them. The being an attorney is important for anybody who's acting as an attorney. And then their third one, which I think has been newly published looking at the cover, is everything about healthcare directives in New Brunswick. So those are really important. Those are really excellent tools to access. We also have the Financial and Consumer Services Commission in New Brunswick. Their website is there. The Seniors Forum of the Government of Canada has an excellent tool on what every older Canadian should know about powers of attorney and joint accounts, and I think wills as well. And the Canadian Foundation for Economic Education has a wonderful series on Let's Talk Money, Seniors' Powers of Attorney, and their tool is also very well done. For healthcare directives, I've given you 3 of the ones that are available. I really like the Planwell Guide, which is produced through a professor at Queen's who was a former ICU doctor. It's about serious illness planning. So it's not just applicable at end of life types of situations. Advanced Care Planning Canada have also really updated their documents and processes to indicate that this is a lifelong activity to take. And Dying with Dignity have always had a number of good resources in terms of specific types of health issues or scenarios and what kinds of medical treatments may be applicable in those situations. Here in New Brunswick, we have the public trustee, part of the New Brunswick Legal Aid Services Commission. We have the Seniors Advocate of New Brunswick and the Adult Protection Unit of Social Development, which all of us hope we never have to be involved with. And so here's my presentation, my contact information, and Tanya and Rosemary, there are probably questions that are out there.
Yeah, absolutely great presentation. I mean, these 3 presentations were fabulous. And, you know, I think that, again, it's a lot to digest for people as well. And we would encourage people to, you know, if they do have other questions, to either get in touch with the individuals, with the presenters, or, you know, certainly we're happy to field these as well. There are some questions in the chat, and a couple of them are ones that certainly in terms of making sure that people have, if people want to access MAID, so medical assistance in dying, is there anything that you can suggest in terms of ensuring that this is part of, I mean, clearly not part of the will, but part of their advanced directives, for example? Do you have any
Yep.
tips on doing this?
Yeah, so this is a question that comes up very frequently, and actually our National Canadian Bar Association, we're doing an update on MAID on the 17th of June. So there's been a number of clients that I've sort of said, well, wait till I find out if there's, you know, what's happening. So the current situation, of course, is that MAID is available if you qualify at the time that you're applying. It is, you know, mainly persons at the point of time that they have a significant, you know, diagnosis and meet all the other criteria. They have extended it to include Audrey Parker's amendment to provide a very limited amount of advance directives in terms of you qualify, but you don't want it right now, and can you have it later if you lose your capacity to consent at a future date. What we don't have yet in the provinces, with the exception of Quebec, is the ability to have an advance directive that will be implemented at a point in time if you no longer have capacity to consent to the process. This is one of those items that has been studied and is you know, in the process of being reconsidered. It obviously ended with the legislative issues that have arisen in the past 2 years, and of course, MAID for mental illness alone as a sole issue was one of the big triggers in them deferring discussion about it for a period of time. But but I know I'm asked about it a lot. So what we recommend to people is that if you're making a healthcare directive, you can include in that directive, with the idea that you understand the legislation is not currently able to accept it, but in the future, if the law changes, you would want your attorney and the medical profession to undertake this procedure, and presumably you're able to articulate at what point in time that would be appropriate. And of course, if you don't have capacity, there is a significant amount of resistance to not, to say, well, how old is this healthcare directive? Maybe they feel differently about the situation they're in at this point in time. So you have to be, I think, very specific about at what point is it, will it be appropriate, and why? I think the other 2 pillars that will make that happen are if your support network, knows about it, your attorney agrees to it, and if the healthcare profession this is something that they've seen this before. This is they agree that, this is the stage at which this needs to happen. Quebec, as I've said, it has implemented legislation as of October the 31st last year that provides for persons to sign up for MAID in advance. You need to have a Quebec healthcare account, and that's all I know about it until June the 17th, when I hope we hear more about what their process looks like, what people have to do, and how they do it. I will say the Dying with Dignity link that is there, they do address that in their personal care healthcare directive wording. So you can look at what they've suggested and see if that is one of the things that gives you some clarity in terms of what, how it would be conducted and when it would be conducted. So the issue about family members being in disagreement, always issues. So, but I tell people, make the story, right? This is your story. You get to write it the way you want to. And if you have been, are fairly articulate about when and what it is that you feel makes your life no longer worth living, write it down and assess it on a regular basis and keep your healthcare directive up to date. And if you can't get agreement among your family members, see how you may satisfy some of their worst concerns.
Right, right. Good answer. Thank you. That's really great. I had I had another question for you as well. Thinking about, when you create your will, and you mentioned that, you need to have everyone has to sign at the same time. What happens if your witnesses die before your will is actually needed?
Yeah, everybody scratches their head. No, all the provinces in Canada, in terms of accepting a will for either probate or registration in a registry office, do require that there be an affidavit of execution in some format, usually by one of there's some provincial differences, but usually one witness to the will has sworn that, essentially you were all three together and when you signed the will on such and such a date. In New Brunswick, since the 1980s, the legislation said that that affidavit of execution can be made at the time you sign the will, or it can be done at a later date. Most lawyers, I think, change their practices so that the affidavit of execution is signed at the same time that the will was executed, but I have come across more recent wills in which there wasn't an affidavit of execution done at the same time. I know myself and other lawyers, we have tracked people down. Someone who was the legal secretary to a lawyer who died, who is now working in a convenience store in Beresford, was one of the people we found. You do your best to try and locate those witnesses that you have. I did have one where both witnesses were deceased. They were a lawyer and his staff person. And we're able to use other kinds of evidence. If we can convince a judge that it's pretty clear that, that will was done by that lawyer and that witness, I have gotten them accepted for probate by providing a lot of other information, surroundings that prove that it was that lawyer's signature and it was their staff persons, but that they're both deceased. So it's possible to do, but extra time, extra cost, extra complications.
Okay.
Where are we now?
Well, we've got one more question, I think, for you. And again, this is kind of opening up another kettle of fish here, but just asking, because you are very involved in looking into elder abuse, the issues around elder abuse. So the question is, in your experience and, just very sort of top of mind things, What are some of the less obvious forms of elder abuse that people may not recognize? And I know we could spend a whole session talking about this entirely, but just top of mind.
Yep. Well, you know, the major kinds of elder abuse are physical, sexual, emotional, financial, violation of rights and freedoms, neglect, systemic abuse. And unfortunately, we have data challenges about understanding exactly how many of all of them or each of them have happened. And some of it depends on where you are and how it's calculated. But, you know, there was a huge increase from 2020 to now, or over the first couple of years, of calls to some of the helplines in other provinces. So what we might have said was 6 to 10% before 2020 jumped to 8 to 15%. So you know, in terms of my own experience with elder abuse, some of which happened before I became a lawyer and was working in a medical office, which is where my eyes were open to it. But you know, in terms of what I have personally seen as a lawyer, I've seen people who are, you know, yelled at and emotionally abused because they don't, you know, the family member doesn't like what they're doing with their money or other types of things. I receive all kinds of phone calls about and have seen the evidence of financial abuse, people who have taken other people's money out of their bank accounts because they were worried that the nursing home would take it. Sometimes they can put it back. Sometimes I've seen one that was a business, the 3 children, one son was a business person. His business was failing. He cleaned out his father's accounts. They didn't really find out until after he died because, of course, then the siblings are like, well, where's our share of the estate? But it was long gone. The systemic abuse, of course, you know, COVID, if you only have to, I'm sorry, I've forgotten the name of the movie that was documentary that was produced in Ontario about, and the book and all the books that have been written about systemic abuse in institutions. And in fact, I mean, you only have to read our seniors advocates, previous seniors advocates about George to understand what's there. Neglect is a tough one, whether it's the person themselves who is not able to meet their own needs or whether it's other people meeting their own needs. And I will say from, you know, understanding about what the burdens are that caregivers are faced with, that the saddest story I have received in the past couple of years was from a gentleman who lived in a rural area and his wife had Alzheimer's, and he was in a real pickle because he didn't have much in the way of support. And he left his wife to go get groceries, and it was February, and she left the house. And unfortunately, they, you know, had found found by the RCMP at a later date. Obviously, adult protection became involved. She was placed in a nursing home, and he was not able to visit her or to deal with even things. And I think the public trustee was named as her attorney, but whole issues around the house and about money accounts and paying bills was just a nightmare. And those, you never forget those stories when people tell you them. And while I know it was a neglect, this is from a lack of resources and people and
So for
and
people who are,
systems.
sorry to interrupt, but for people who are experiencing or who think that there may be something going on. So for example, Angela has posted here about a situation, you know, to try to deal with something where
Mm.
people have taken things. Where should
What
people
do you
go?
do?
Where are the places that, you know, is it the police? Is it like, what's the best option for people?
Yeah, and this is why we need elder abuse networks in every province in Canada with people that can sort of direct you through these. New Brunswick doesn't have a network yet. And you know, ideally, there would be, you know, the ability to talk to somebody who could point you in different directions. The 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 police is an interesting one because they sometimes think that if it's financial or family matters or power of attorney, that they have no jurisdiction, which is not true. The criminal code has enough you know, misuse of a power of attorney rules out there that they could be involved. Again, do they have the resources to do that? So sometimes this is where, you know, Karen's view about be persistent is important. Sometimes, you know, you can get lawyers involved that at your, you know, at your own cost. So that is a problem. And I know of circumstances where people have, you know, A, been very frustrated doing it, but also B, being successful doing it. Adult protection will not deal with financial issues unless there is also other kinds of abuse happening. So, you know, FCNB don't deal with it. There is a dearth of resources, a real gap of resources in terms of trying to do it. But, you know, if you have, you know, if the legal procedures are there, it's making it happen. That is the problem. And that's why the preventing of it is so good. But people are, you know, all the time looking for someone else's money and end up taking it because they think it's in, you know, the other person's best interest, or because they think they need it more, and really, what does it matter anyway? So yeah, there are things that can happen. In fact, there was a very interesting case in Ontario where there was a daughter who moved into the mother's condo and was abusing the mother, and the other daughters, who were the previous attorneys, and were trying to undertake legal provisions to deal with it. The outcome in that case is that there was actually a decision in which they used the rules of the condo to have the daughter evicted, and because she was abusive and harassive, not only of the mother but also of other people in the condo building. So, you know, sometimes there are ways to do it, but I mean, predatory marriages is a big problem. Coercive control is a huge problem. They removed the provisions around coercive control from family members other than a spouse from the legislation that's currently in front of Parliament, Bill C-332, I think it is. So more can be done and should be done, but there is, you know, it needs everybody to kind of push for it. Heather Pope Campbell has a wonderful Substack and other, I don't know if it's called Dementia Justice. I think it's Dementia Justice, and she writes wonderful. She's out there advocating to stop a lot of these abuses, coercive control.
We'll maybe put that in the, Tanya, if we can find that, we'll put it in the chat or as one of our resources. That would be really great. Yeah. Did you catch the name?
I will send, I mean, if you want to add it at a later stage,
Right,
Tanya,
great.
I can track her down, but I'm pretty sure it's Dementia Justice, something like that.
That's great. That's great. Listen, I really, you know, I'm aware of the time. I really want to, this has been fabulous, I have to say. You know, thank you to everybody for joining us today for conversations that matter. Clearly, they matter. And I do want to say it's been a really meaningful morning of dialogue, of expertise, and reflection on how we can support seniors, especially when navigating care becomes so complex. And that's certainly something that I think all of you have alluded to. Some of the themes, I think, for me anyway, stood out across the discussions. One of the things, just to sort of highlight the New Brunswick Supported Decision-Making and Representation Act, does remind us that legislation can help to reframe aging. not just in terms of risk, but in terms of rights and autonomy. And I think we need to, pay attention to that. The other thing as well, Greg alluded to this, and I think the need for training. So training and Jody, you as well mentioned
Yes.
capacity assessors, healthcare providers, community-based professionals, all in the environment of seniors care really need to be trained, educated. This is a place where CHEN is certainly very interested and involved, but really to ensure that informed decision-making, whatever that informed decision-making is, can be supported with compassion and confidence, because these are things that we need to recognize as well. We heard about how the navigator role is evolving and the pharmacist role is evolving as well. So not just in function, but in the approach that is being made. We recognize that these values as knowledgeable guides and advocates for individuals and families at all points of the care system are really clearly there and need to happen. Another thing too, I think, is that the reality of solo aging, lack of family support. This is another place that challenges us to think about how systems and services really need to pay attention to what happens when the next of kin just isn't there. And finally, I think we really have seen some hopeful examples in my view anyway. I'm always on the optimistic side of things, that there is an opportunity for regional collaboration. So collaboration across Atlantic Canada and across the country, a recognition that care doesn't need to stop at the provincial borders, especially when we have shared learning and shared challenges that unite us. So as we close today's session, which was just so fabulous, I think, we invite you to continue these conversations in your own networks, your own communities, and stay connected with us, with the Canadian Healthcare Education Network. We'll be sharing the recordings, the resources, and also providing you with information about the upskilling, training, education opportunities that we have and that we're going to be rolling out in the fall of 2025. In particular, I really want to thank the three presenters who gave so generously of time, your knowledge, your wisdom, and your passion for these important topics. And thank you to everybody who joined us today for listening, for contributing your thoughts to the discussion. We have recorded the session on video and we'll be sending out the link once it's ready. It will be hosted on YouTube. We encourage you also to share. And as well, I'd like to, again, encourage you to subscribe to our website, www.CHEN-RCES, and stay tuned to more information from us here at CHEN.